So I'm Ben Tonneau. I'm a physician with CapitalCare. I'm an internist in Schenectady. I use IXNI to access the records for the patients. For example, today I saw a patient who was in a hospital at Sunnyview, and I use IXNI to access the records from Sunnyview, look at the discharge summary, look at blood test results, x-ray reports. If I didn't have IXNI, I would have spent it probably 10-15 minutes, probably not myself, but the staff, calling the hospital, getting the discharge summary, getting a copy from the x-rays, getting a copy from the lab results. And this additionally this was an older patient, and a lot of old patients don't really have their medications list with them. So it's extremely helpful in that sense. When I access IXNI, speed is very important. When I access the hospitals, usually there's not a lot of speed. In addition, when I access the hospitals, I have to have different passwords for different places, and it's time consuming and it's a pain in the neck. Having only one portal to access all the information obviously saves a lot of time. And it's not just for myself, but when the staff can access the information, it also saves time, for the staff. Having all the data available very quickly through IXNI is very important. Sometimes if I don't have a discharge summary that's available within the next few minutes, the patient is going to wait. The staff is going to have to do a lot of phone calls. I may not be able to make the right decision because I don't have enough time. When we use IXNI, we reduce the risk. What I mean by risk is a lot of time the patients take a lot of medications. There is a risk of drug interaction, and if I don't know exactly what they are taking, I can prescribe something that could be potentially risky. Actually, I remember a patient recently who was discharged, and he was put on a new medications for his cholesterol. He went home and he took that medication in addition to his previous cholesterol medication. Now with IXNI, the risk is gone, because as soon as he comes to the office, I can tell him right away, please do not take that medicine. I know exactly what you were discharged on, and I know what you're supposed to take. So it helps avoid potential major errors and mistakes. My advice is that the system is very good as it is. It's going to save them time to access information from hospitals or other providers like us, CapitalCare. We have about, I think our group has around 100,000 patients in the electronic medical record system. So if the specialists could access that information, that would save them, for example, a lot of time. Let's say a cardiologist sees a patient, the patient has high cholesterol, he can access the record very quickly and see what was the last cholesterol profile. That avoids unnecessary blood work. The system will get better as time goes on, and once all of us are on board, specialists, internists, family practitioners, pediatricians, you name it, all the different specialists, it's going to be perfect.